Today we're going to answer your physical therapy questions that you had for us.
That's right. We have 4 different viewers asking us real questions about their problems, and we're going to give them detailed answers. Stay tuned and you'll be entertained and educated. I'm Brad.
I'm Mike, and behind the scenes we have Bob, and together we're the most famous physical therapy team on the internet.
In our opinion, of course, Mike.
So our first question comes from username Rochelle H. Mann. I probably butchered that, but I apologize. Anyway, the question is, do you have a sitting exercise video I can do? I'm in a wheelchair.
The answer is yes, we do. We have more than one. If you go to Bob and Brad and YouTube and wheelchair exercises, we have one excellent one we'll share with you in just a little bit. We're going to show you 4 good exercises quickly, and then we have a real patient. Okay.
Technically 5-6 exercises, but let's go to it.
Okay, the first one, wheelchair push-ups for arm strength. Here on your armrest, and we simply push up as high as you can and down. Now, if you cannot do this at all, what you'll want to do is put a pillow or a cushion on the chair so it raises you up 1 to 2 inches, and it makes a tremendous difference. Do 10 of them like that. After a week or so, you'll be able to take that out and then proceed from there. Let's go to number 2.
So number 2 is a W stretch. So this is more for your posture if you're stuck forward, if you're sitting in a wheelchair all day. So try to get in good posture begin and do what Brad is doing. Bring your arms back and make a W like this. You can do 5 to 10 repetitions. Hold each for a few seconds. If you happen to have shoulder problems, you can certainly leave your arms at your side like this.
There you go. And the next one is a trunk stretch. Your right arm, you're going to reach up like you're reaching for an apple just above your hand and lean over, stretching the right side if your right hand is up, and then go and stretch the left side. Do 5 on each side. Make sure you breathe and relax actually with all of these. Good. Number 3, Mike.
So that was number 3. Number 4.
Number 4.
So we're going to do a combination for your legs. First, we're going to start with some ankle pumps. So we're going to do 10 of those. Go on your toes and your heels. And we're going to follow them up with some kicks. So we're going to kick up, hold for a few seconds, back down, make sure to alternate. And we're going to do 10 on both sides as well.
Good. And finish up with a real simple one, marching in place. Get those knees up as high as you can. If you do have weak hips, simply assist with your hands. Get them up, get some range of motion and strengthening at the same time. Mike, let's talk about that real patient video.
If you want to go to the end of the video, it'll show up on screen, or you can go to the comments section. We'll link the video. It's called Chest, Arm, Back, and Core Strengthening in a Chair or Wheelchair, Upper Body with Exercise Bands. It's a funny video title name.
Well, yeah, it is, but it is. Again, we have a real patient. She's in a wheelchair and demonstrates the exercises very well.
Our next question comes from Jay Daniel. They watched our channel for a long time, have been doing some of the shoulder exercises we talk about, but is having some bursitis pain in the shoulder, wondering what they can do.
Well, this is a good question, and because of limited information, we're going to start. If that shoulder is so sore, it's hard to get range of motion at all. You back off and do the Codman's exercise. If you can't lift it at all, you simply use gravity, where you just put your good hand on the tabletop, lean forward, and let gravity just work that. We call it the pendulum or Codman's exercise. For 30 seconds, just allow it to relax and flex and retract back and forth. You can go right to left and even make circles all in that 30 seconds just to get the joint moving, and then go back, put a cold pack on it. Do that for a day or 2 till the pain settles down. Then go to the next exercise, which is?
We're going to do the W stretch. Now you can do the seated, standing, in the doorway, whatever works. If you have good mobility, you can try to lift your arms up and actually make a W. So relax, bring back. This is going to help stretch and work on your posture, because most people with shoulder pain are rounded forward like this. Again, do 10 repetitions. If you have trouble going up like this, you could certainly go kind of just at the side and keep your arms down here.
Right. This is one of those little things that makes a big difference. If the posture is proper, the shoulder joint works much better with less pain. And then the next one, to get that shoulder to start going up, if you're unable to, a little painful, but it's kind of going, take the other hand to assist it, put your hands together like this, and this will be my sore one. Lift and do assistance with the strong hand. What's going on? Oh, I thought you were going to...
I'm using a stick in case you don't want to hold your own hand.
thought you were going to hit me with it.
Whack.
So go up as far as tolerated. Using a stick or a cane is really an option that this has been going on for decades in the therapy department because it works well.
So do 10 repetitions of that. And our last one comes from our friend, physical therapist Rick Olderman. We're going to show a couple options here. Brad, you want to start with it?
Right. So the shoulder's improving by now. You're able to reach up without much pain. We want to stretch it and strengthen it on all fours. Do this on the bed or carpeted floor. Hands out here on all fours, just like I'm going, and we're going to put our hips or our buttock back towards our heels, and my hands stay planted down, pushing into the floor, and I'm getting a stretch, and we're actually stretching those shoulder muscles so the scapula moves properly. Very critical part. Oh, what's going on over here?
If you have some knee pain and don't like kneeling, you can do this in a rolling stool or normal chair. Same concept.
Ooh.
Sit down, stretch your shoulder. Notice as I move my body backwards, my shoulder is slowly going up towards my head. Again, just do what's comfortable. If your chair doesn't move, go here. Maybe you have a towel. Just push forward and slide. Same concept, just... if you have bad knees, it's the easier option.
Right. So do 5 to 10 of those. That will stretch the shoulder. Now this exercise complements it. So do it afterwards. And it's called the pinky wall slide is what I personally call it.
So you're going to put your elbow through your pinky, touching the wall the whole time. Do not let your elbows pop up. Go up as high as you comfortably can. If you just have pain on one side, you only have to do it on one side. You don't have to do both like I'm showing. Go up as far as you can. Lean into it. Sit here for 10 to 30 seconds, breathe, come back down, keeping contact with the wall the whole time. When I'm doing this, if you're struggling to lift your shoulder up, try shrugging a little bit, and that may help. This teaches your scapula, or your shoulder blade, to work with your shoulder joint, which could help some impingement or bursitis issues you may be having.
Right. So take your time with this. If you cannot hold it up for 15 to 30 seconds initially, do what you can, wait for the next day or two, and progress to that length of time. Good. That is wonderful. Nice job, Mike. So again, take this in order. You may have to rewatch again to find out what level your shoulder is at. Is there anything else we want to add to this, Mike?
I don't think for this one. Let's go on to the next question.
Number 3.
Our next question comes from Michael Graham. Is there anything you can do for Dupuytren's other than surgery? I have it on both hands. Thank you for all your help. And I probably pronounced that condition wrong because it's a mouthful.
That's right. Actually, you're in luck. We have excellent information from this. We did do a video because Bob actually had Dupuytren's. That's the way I pronounce it. And it's when the ring finger goes in like this and the tendon gets contracted and there's a lump in there. It's really makes a difference on how you can use your hand. Now, in the video that Bob talks about, we're going to put it there. He goes through it in detail with wonderful description of how it develops and how you can treat it or live with it. And then we found out he actually cured himself since then. That was a 10-year-old video. Watch the video. It has excellent reviews and people are very satisfied. I watched the whole thing because I couldn't remember what he said and it was educational. Now, the next thing is there is a treatment for this since then that we didn't have then, and it's I believe it's an injection. It's called Xiaflex. You need to speak to your doctor about it. It's an injection, and it does have 44 to 64% of the people resolve their problem with the injection. But before you do that, now Bob had just informed us he took care of his while doing pull-ups, and what it was. Can we scoot over here? These are pull-up handles, but you can use a regular pull-up bar. I think that's what he used. I don't know. Either way, it doesn't matter. I'll face this way. And Bob, were you just hanging there and the weight of your body pulled the contracture?
He was just hanging.
Right. So he wasn't actually doing pull-ups. He was hanging, and that was enough to stretch and actually reduce or correct the problem. No guarantees that's going to work for you. He had it for many years before that actually occurred. So that is no guarantee. It's just something that worked for Bob for sure.
We'll put that video link in the description or comment section down below, Michael, so you can find it there. It's called Dupuytren's contracture. Start as lump on hand. and how to treat. So just click that video link and you can find out more detail there.
Yeah, and it's like I don't have any gray hair on that video.
I'm not even in it. Our last question comes from MS and then a bunch of random numbers and letters. So we'll just call you MS for now. So hello, please make a video on shoulder pain during push-ups. Now to answer this, we're going to relate to a famous physical therapist called Kelly Starrett. And he talks about having an optimal push-up position that can help minimize the amount of stress on your shoulders, which we'll get into in a second here.
That's right. This is an excellent question because so many people do not do push-ups properly or they don't know how to modify it so they can do them without shoulder pain. So Kelly Starrett is the man. He's written books on this and gives classes on this to therapists. Mike, go ahead and talk about what he recommends.
So the first thing you want to do is kind of visually see how you're doing a push-up. Where your hands go is going to depend how much stress is going on your shoulder versus your tricep. So if I'm way wide out here doing wide push-ups, this is a lot more on my pecs and my shoulder. What you want to do is bring your elbows in closer into the side of your body like this. Now if I keep them close and go down, I'm engaging my tricep more, my pecs, and I don't have as much strain on my shoulder. You can kind of mess around with what feels best. Some people might feel good with elbows tight. Some people flare out just slightly, feels better. Most of the time, if you're way like this is going to be problematic on your shoulders. So try to go either right next to your body or maybe like a 45-degree angle.
Now, we do have a video that goes through push-ups in detail in regards to form, what he had talked about, and we're going to link that to it. It's about 10 minutes long, and I guarantee you every aspect of the push-up is gone through in there. Bob and I made it a few years ago, but it is spot on. And we do want to add, this is what I use. They're called perfect push-ups. My wrists hurt because whatever joint issues I have. When I use these, everything feels better between my wrists and my shoulders.
Now, the nice thing about these is compared to just normal push-up handles is they actually move. So if you're going down into a push-up, you can actually kind of rotate it around and see how your shoulder feels. Maybe it feels better out here, maybe in here. Do what's best, what feels optimal for you. But yes, it takes a lot of pressure off your wrists as well because some people are uncomfortable going like that.
That's me. All right, the video, perfect push-ups guaranteed. Do them right and get stronger is the video. The link will be there, right, Mike?
We can put it down below, but we would like to mention you can try doing push-ups in different positions and see if that bothers your shoulder. So countertop, table, or wall push-ups could be an option to start.
Right. This is a wonderful way, and implement the rules that Mike talked about. Not too wide, not out like this, but in where we talked about. And countertop can be a great way to start out. Once they get too easy there, go down to the traditional floor push-ups.
So those are your questions answered. If you have a specific question or problem you're dealing with, you can leave it down below in the comment section, and perhaps we'll pick you for next week.
That's right, and keep pushing up.
Bob and Brad, the two most famous physical therapists on the internet.